an original.
From Story Studio Network.
The 2030 Project is a Story Studio Network podcast sponsored by Daily Bread Food Bank, a Toronto-based charity whose mission is to collaborate with all to eliminate food insecurity and advocate for solutions to end poverty. What would it take to eliminate poverty in Canada by the year 2030? This is the 2030 Project. It's a podcast that explores why poverty persists and what we can do about it in this country. We endeavor to uncover what's been successful with Canada's poverty reduction strategy, but then what needs to come next? The 2030 Project tackles some of the biggest and the most pressing social issues facing this country today. I'm Dave Trafford, and thanks for joining us. In this episode of the 2030 Project, what's the real cost of having our kids go to school without breakfast? Put it another way, what is the ROI on a universal breakfast program? There's no means testing, just an expectation that every child attending school will start the day with a proper and a nutritious meal. So, to talk about it, around the table here, we're joined by Judith Barry. She's the co-founder and government relations director at Breakfast Club of Canada. John Stapleton is a longtime advocate in terms of what the conversation around the needs of those who live with and on welfare. And we're going to talk about the welfare diet. He didn't invent it, but he has spent the last, it must be a quarter century looking into it and how difficult that is. And you want to talk about the cost of doing something effective. And Dr. Dina Kulik is a pediatrician here in Toronto. Again, there's a health cost to all of that. So listen, thanks to the three of you. I'm thrilled that we've got all of you around the table here to talk about this today. And I guess let's start with you, Judith, just because there are many people, as I suggested, and maybe I've got it wrong here, but I think some people think of the breakfast clubs as being a nice thing to do for a community. I don't think we really understood the economic effect or the economic benefit of these clubs. And it's not just yours. There are some that just start up in schools or church basements or whatever it might be. That the economic integrity in terms of the club, how important it is to making sure people are properly fed. I think we dismiss that. We overlook it.
Mm-hmm. And actually, I would have maybe two answers for you or perspectives to bring. Because at first, 27 years ago, when I co-founded Breakfast Club of Canada, we were rooting our rationale into a poverty reduction strategy. But then we realized that, no, it's not a poverty reduction strategy, breakfast programs or school food programs. But for sure, it is bringing a safety net for those who doesn't have access to healthy food at home for a variety of reasons, right? And so the programs are universal. It's accessible to the whole student population of the school, and it attracts not only the ones that do not have access to healthy food at home, but it attracts the students that are hungry for other reasons, right? Mm-hmm. Due to maybe a lack of healthy eating habits, due to a stressful family morning routine, and the absence of parents that are going to work early, right? And some students are not hungry when they're at home, but an hour or two later, they're hungry, right? And they need food to learn. And so you're right. Then when we think about it, it's a great intervention and tool for a variety of outcomes. Yes, health and education outcomes, but social connectiveness as well. And even in terms of community engagement and to create, yes, some economic local benefits when we think about connecting those programs to local food production and local harvesting and farming. And when we think about eventually our ultimate objective would be for those programs to be qualitative, sustainable programs where at least one or two chiefs would be hired. It's not what we can afford right now in Canada, unfortunately, because we don't have a national school food program, but in the near future, we might have one.
So I want to get to that because it's going to be, I think that sort of is the next step. And we will talk about what are the positives that came out of COVID, so to speak, as we're trying to do here. But my sense is similar to the way Daily Bread has operated, it has become a victim of its own success. In as much as it provides such great service, it has got the logistics down pat. There's so many best practices you can learn just from watching what Daily Bread does, specifically in running a food bank operation. Do you worry that you've been too good at this in as much as that has also, to some degree put this issue on the back burner, that has taken us this long to get to even a discussion around a national program?
And there's multiple student nutrition stakeholders across the country that are really good at it. You are right. Breakfast Club of Canada is one of them. There is many others at the provincial and community and regional levels. And there is a patchwork of school food program right now in Canada. And the federal government has finally moved forward with some clear commitments towards developing a national school food policy and eventually implementing and supporting such a program.
Yeah, well, so, we'll see.
Yeah, we'll see. But we're hearing that there's some evolution in that regard, but we still need the current community stakeholders, and we need everyone to be part of the solution. And that's an important connection that I think we should talk maybe later on.
Well, sure. Well, and I don't mean to be the skeptic in the room, but, on the last episode, we did talk to a woman who works for Project 2000. And we'll recall that 2000 was the goal to eliminate poverty for kids. Okay. We're a little ways over the deadline there. Dr. Kulik, when we look at that effect on kids just specifically, how much of that is evident in your own practice? How much of that issue around food or the accessibility to food or regular healthy food in their daily lives comes to play in their overall health?
I think it has huge impacts from a health perspective, of course. If we're not getting adequate nutrition, kids develop iron deficiency, anemia, they develop vitamin D deficiency, other kind of health conditions. But I think even more importantly is how does it affect their every single day life, right? If you're thinking about how hungry you are in class, how much are you not able to focus on the class, the learning, the education? You're not fueling your brain with the vitamins and nutrients and macros that you need. How well are you going to be able to take in the information, process the information, learn appropriately, perform well on those tests and everything else we have to do when you're distracted by the fact that you're so hungry and you're not able to focus? A lot of these kids will fall farther behind in class. They might fall farther behind socially. And that has dramatic implications for their entire life, really. We're not talking about just that day. We're talking about a cumulative effect of missing out on things day by day. And then, of course, some of these families don't necessarily get to school every day, or there's instability in their lives in many other ways. And if you're not consistently able to do these normal things that we think of as normal for kids, you wake up, you have breakfast, you go to school, you get your education, you come home, you might do extracurriculars, you've had lunch at school, you come home, you have dinner after school. A lot of children are not getting the value of sometimes any meals or maybe one meal a day. And these breakfast programs sometimes provide all the nutrients for a child in one day. And without them, these kids can fall farther behind. And of course, as we saw with the pandemic, children that were home that were most vulnerable, they weren't getting the nutrition. They didn't necessarily have internet or, technology to connect to their school environments. Their parents sometimes weren't necessarily at home because they were out working to afford everything that they need in their life. So we saw such instability for the kids that were really the most vulnerable, and that set them even farther behind their peers in some situations. And we have so much more to catch up on now.
Are there things that you are looking for now as a result of that experience in your practice when, a kid comes into your office?
Yeah, well, we're always watching growth parameters, making sure that children are gaining adequate weight, gaining adequate height. Of course, we do full exams on all of our patients to make sure that they're developing and growing as they should be. And there's always lots of conversation I have with my patients about, what are you eating in a day? Tell me literally, what do you eat for breakfast and lunch and dinner? Give me an example of that so we can make sure that they are getting the adequate amount of iron and calcium and vitamin D and everything else that we need. Some kids, whether they have access or there's not access to food, have lots of snack food throughout the day. And we know that that has cumulative effects on your brain and your growth. And some of these foods are cheaper to access, cheaper than fruits and vegetables and proteins. And so we often see these kind of deficiencies in these children. And we're always on the lookout for it as pediatricians, for sure.
Okay, so let's get into the real access issue. And now it's probably more pronounced even than it was 6 months ago. And that is just the cost of the food. And we've spent a lot of time in the first season talking about the systemic barriers that certainly in Ontario, but governments across the country have established in an well-intended effort to support those who need it most. So, for example, in Ontario, we have the Ontario Disability Support Program and we have Ontario Works. Both of them are a form of welfare where those who are unable to work for whatever reason are supported and they get their check. In this province, during the recent election campaign, all four of the major parties saw fit almost on the same day to announce that they were going to, in some form, to some degree, increase ODSP and Ontario Works payments. Understanding, I think, that finally, altogether in one voice, they agreed that that level of poverty, quite literally, it was legislated poverty in some cases, needed to be a priority. John Stapleton, this takes us right back to the annual project that you embark on, and that is to go and do your welfare diet shopping. And people, what the hell is that? Way back to 1995, I can remember covering the Tory government of the day when they made cuts to ODSP, and people said, well, how are we going to manage this? Well, and then the minister of the day probably made the biggest mistake ever, and he tried to actually dictate to people, well, here's what you can buy for the money we are giving you in your monthly provincial check. You've been fairly diligent about going out and doing your welfare diet shopping. Dollar for dollar, were they better off in 1995 than they are now, or has that actually increased over time?
Well, they were actually better off in 1995. The increase in the welfare diet, it was the same shopping list that cost $90.21 in 1995, and believe me, it was a bad diet. It wasn't a nutritious diet by any stretch of the imagination. But statistically, if you keep shopping the same diet over and over again, item for item the same, and do that carefully, we found, and at the same store, the same supermarket in Scarborough, and that diet now is over $190. Now, so that is more than a 100% increase, but I think, as we know, when Mike Harris reduced the Ontario Works rate by 21.6% in 1995, he reduced it to $520 a month. Now, the current rate for Ontario Works is $733 a month, and you don't have to be a mathematician to know that a 100% increase in 520 is well over $1,000, and part of the problem is that these rates are not increased with inflation. And as a result, they have fallen behind. So let's take the $733 in the same Scarborough community. I know people who are receiving that $733, and I also know that they pay at least $500 a month for rent, and that's for an illegal room in an illegal rooming house shared with someone else. That's what you can get for $500. We know that a nutritious diet can possibly be shopped for over a little over $200 a month, but there's a catch, and the catch is you have to be able to shop it all in one go, which means that you are able to do a little bit of bulk buying. Once you bring it home, and you got to have the transportation to do that, and that's not a bus or walking, because it doesn't work. You have to have storage, number one. You have to have freezing facility, number two. You have to have a refrigerator to put it. You have to have adequate cooking facility. And maybe most of all, you have to have the knowledge to know exactly how to cook and take care of that diet. So there are people that say, hey, I can do a nutritious diet for $170 a month, and they probably can, but they got a van. They can shop at a bulk store. They can make substitutions of various things. They've got oodles of storage space and freezing space and refrigeration and cooking. The Ontario Works recipient may have part-time use of a microwave and a hot plate, and maybe get a named shelf on a refrigerator if they're lucky. In the rooming house that they live in. So they don't have that infrastructure. And when you think that it's over $200 a month for that nutritious diet, if you have all those other accoutrements and you're paying $500 in rent, you have $33 left over for transit, for a phone, for internet, for personal grooming products, and everything else. So those people end up living like modern hunter-gatherers in our urban society, because they can pay for things for about a week, and then they have to make this elaborate long route where they go from meal plan to meal plan to meal plan around the city, and they from an anthropological perspective, I think they look exactly like hunter-gatherers. And so in many ways it doesn't work.
Well, yeah, and I think it doesn't take long for us to do the mental math, even if as bad at math as I am, to figure out that this is problematic. So, and I'm to your point earlier, Judith, the idea that you have this. There's no means test for the breakfast club. I mean, all the kids who go to school, they line up, they get their food, and they have access to it. In your circle now over the last 2 years, where we saw such pressures on, and in some cases, as John describes, these are families who are relying on that kind of benefit, and I use that term loosely. Where did you see the breaking points? So I'm assuming that there are people in those communities who just didn't say, okay, well, too bad we can't open the schools. What was your sort of fallback, or was there one?
It was clear, actually, not only for Breakfast Club of Canada's team, but for many school communities, that the need was greater than ever. And we all had to act on it quickly. So we pivoted our support to really help the school communities that were improvising, actually, and getting organized to still provide healthy food to the kids and their family members.
So how did you do that? What was it that you would have to break the model, build a new model pretty quickly to manage that?
We reached out to our network and even beyond, mentioning that, hey, if there's any community organization across the country, since we're supporting more than 3,500 school communities across the country from coast to coast to coast, we knew that if there's community organizations involved in those communities, they're reaching the kids that we're used to reaching doing at school, right? And their families. So we said, hey, call to action. If you need help to support the families with healthy food, and the children will be there to support. And we on one end, and on the other end, we reached out to all our public and private donors and individual donors saying, hey, we need to do something right away. Please help us. So we implemented an emergency fund. And actually, everything within 2 weeks got organized and implemented in a way that, yes, we were receiving a huge amount of requests and applications from schools, from community organizations that were already getting organized to provide support. And on the other hand, we got the great engagement and mobilization and a very positive reaction from the donors, government and private companies and individuals that were like, obviously, wanted to act and wanted to do something.
Yeah, and I love that idea because this is a sort of in action. We have seen the response where we didn't look at the problem, we looked at a solution, right? I mean, and that, exactly. Again, if nothing came out of COVID, certainly that behavioral, that response in so many ways is what was really valuable. Dr. Kulik, I wonder from the healthcare perspective, and I realize that when you're talking about kids, there are so many elements of it, whether it's, getting outside to play, having the opportunity to have a good meal, their mental health, the socializing. I've got 3 grandkids, all under 5, and they were born in and grew up so far. Piper, half of her life has been under the restrictions of COVID-19. And it was really interesting. I asked her mom, so is there an effect? Yeah, she's kind of, but she hasn't hung around with kids, didn't go to birthday parties. And that sounds like something small, but in the development of a 5-year-old who's just about to go to kindergarten for the first time and see other kids in the room that look like her in any great number, there's a whole health aspect to that, never mind sitting down and having a snack with them, that we missed out on. And are we in a place where we're prepared for the repercussions of that? Because that's going to take a while if it ever works itself out.
I'm more optimistic perhaps than how that was just framed. Luckily, most kids were only out of school or daycare for a few months and then back in and then back out again. And of course, some kids, their caregivers chose to keep them out for a longer period of time. Some children that would have otherwise gone to daycare, for example, that didn't go, or were going to go to preschool that didn't go. But I'm hoping that, as we get back to kind of more normalcy, whatever that means, kids are interacting with others again, and they're going to the park again, and they might be going to daycare or school again. And many parents spent a lot of their energy trying so hard to not lead to so much trouble for their kid that they spent so much one-on-one attention with them. And that's been really positive for a lot of children, actually, that we all felt so scared for our own children. I have 4 children, less than 11. My youngest is 4, hasn't gone to school yet because of the pandemic, still is not in school. And so I think for many of us, we felt so compelled to do everything we could possibly do to help our kids live a more normal life, whatever that means. But that's coming from my place of privilege where I can spend time with him. I can get on the floor with him and be with him. I'm not worried about having shelter or having food for him or having toys or crayons for him to play with. But if I was a parent that had to do service work and work days and evenings to make ends meet, and even then maybe not, would my children be in a different position? They probably would be, right? I'm very lucky that I have the resources that I have. For so many families during the pandemic, they were in the worst place, having to work or maybe not being able to work because wherever they worked was shut down or whatnot, how do we get to that place of work if it's more difficult and more expensive to get there because of transit? What do we do when we're sick and we can't make the money? And then how do we separate from our kids because we want them to stay well, but we can't make money because we're not working? There's just so many pieces to it that were so complicated for so many families. I'm hoping that because things were locked down, it felt very long, but it wasn't very long in the life of a child, that many of those kind of social isolation pieces will be remedied just by nature of being with others again.
So, we talk about this whole, that we're flirting with the idea of a national breakfast program. And I expect that the way daycare went and resolved itself, I think we saw a need in COVID. And so I think there was a positive there. Then that happened right across the country, that perhaps there would be an opportunity in the breakfast program. But let me ask you, doctor, and this might sound silly, but is there a place for the healthcare providers to take a role in that conversation? Now, what I'm finding, and Judith kind of alluded to this, where as a result of COVID, they ended up bringing people together who wouldn't have otherwise come together. And in many cases, we never would have thought of so-and-so being involved in this conversation. But as soon as we are exposed to the solution, we realize they have something to bring. I want to suggest something, maybe it sounds stupid, but the idea that maybe for folks who are on the plans that John describes, whether it's ODSP or Ontario Works, that, I know in some cases their medical benefits cover their drugs. Is there a place to say, okay, well, then there should be a benefit built into that to cover their food? For example, then come to you and say, okay, we need a prescription for dinner for two. It sounds glib, but I'm not being glib. That in fact, that's as important as somebody's diabetic medicine.
Yeah, very interesting point. We do that all the time for formula for parents that can't access it or can't afford it. So that's something that we very commonly do. Families often ask me if we have any formula samples, and we readily take them from the manufacturers and give them out. It's been increasingly important recently with the formula challenges we've seen in Canada and elsewhere. It is an interesting perspective to have us involved in that way. Unfortunately, during the pandemic, the kids I saw the least often were the most vulnerable kids.
Of course.
And so the access point was less. There are some kids that I still haven't seen since before the pandemic that are the most needy in terms of me making sure that they are okay. But because of the work situation and the illness, and these are the families that got COVID more readily and their family members died more readily, right? These are the highest risk populations. These are the kids that I have least access to. But I do think that a lot of us physicians work in the communities where our patients are living. And as much as we can have outreach to these families, the better. Recognizing too that some families are more readily comfortable reaching out for support and others less so. And I think there's still a lot of stigma around poverty. And some families still tell me that they're worried that if they reach out to me to say that they're in a position where they're not able to as easily get nutritious food, could the physician turn around and then call Children's Aid on them? Those kinds of things, right? And of course, we're all trying to keep our patients and families healthy and safe. And sometimes that's necessary. But there's a lot of fear around those kind of things and a lot of stigma still. So it takes a certain type of caregiver to reach out to a certain type of healthcare provider and have that real dialogue, that honest dialogue, and not have the fear that it will have negative implications, their honesty.
If all of a sudden they broke the mold and said, Dr. Kulik is open for business and can actually prescribe this, and this, which includes a balanced diet, and it's included in the benefits as far as ODSP and Ontario Works here in this province, then some of that stigma goes away.
Eventually, maybe over time, but it also adds a huge potential burden to healthcare providers, some of which may not feel like this is their problem, quote unquote, to deal with. Of course, it's a very important part of child healthcare is making sure they're adequately nourished, but it does add potentially quite a bit of burden to an already very burdened healthcare system, as we found throughout the pandemic.
Sure. And so, John, I think that the solution then becomes political, right? It really does require some leadership to navigate that. We can't just have it siloed.
Yeah. And especially if you look at a program in Ontario, like Ontario Works or Ontario Disability Support Plan, You can keep $2,400 a year in your earnings if you happen to get a job. $2,400 is less than 1/10 of the full-time minimum wage, which the province will allow you to have before they start clawing back the benefit. Let's just look at the Canada Child Benefit for a second. The Canada Child Benefit allows a mother to earn or to have other income of $32,000 a year before a cent is reduced from the benefits. So if you were to ever want to go to an immediate, easily implemented set of solutions, I'm not saying it's going to solve all the problems of a very complex system, but certainly allowing people to have a reasonable amount of income when they start that road back to perhaps towards self-reliance and independence. I know we call it many different things, but when somebody actually is able to get help from family, get a job, get cobble together a bit of childcare, etc., so that either mom can go and earn some money, or if you got singles that are able to do the same thing, the idea that we're immediately chopping money off their allowances in the next month, literally, you're not going to get back on your feet very easily. We all know that people in subsidized housing are suffering the same thing. As soon as somebody gets a little bit of extra money, if they're able to do something, get a few dollars in their pocket, and your rent starts to go up because you're paying more in rent at the same time as your income security is going down, it's not long before you reverse course and head back onto the system. And right now in Ontario Works and ODSP, on both programs, less than 15% of people report any earnings at all. And so there's an opportunity that we have in the system. We see the success of the child benefit. Single moms used to be the largest part of that of people on social assistance going back to 1995. At the time of the welfare diet, there was 200,000 lone parent moms on assistance. Today there's 56,000, and yet our population has gone up by 4 million in the meantime. And now the single parent is the smallest part of these groups of people who get social assistance. Now it's the single person with disabilities or the person without disabilities. They make up the highest part of these caseloads. And if you're to say, well, what one thing changed? Then that would be the thing that changed, is that we moved the kids off of social assistance and we allowed people in July to get a statement. And that statement said, as long as your kids are in Canada and they're in your care, for the next 12 months, you are going to get a stable amount of money, which allows people to plan the next year. Not so when you're receiving a welfare benefit or ODSP, you make money, the next check, your check goes down, then you leave the job and your check goes back up. You have this boom and bust mentality that goes on, and you have no agency. You can't be in a position to be able to plan that future. And I think if there's any one thing, to me, it would be that exemption level, that base amount of money that we would say, okay, you're leaving this program or you're making a bit of money, let's let you alone for a while. Let's let you alone for 6 months, not 3 weeks. And let's let you keep it for a bit and establish yourself. Put a bit of money in the bank. Get a bit more help from your family. You might actually be able to make it. But the confiscation approach that occurs now and the suspicion and the surveillance really turns it around and makes it a different type of program. But the successes are facing us.
For sure, and I was just going to say that we have seen the data is deep enough now that we can look at it and say that there is a very positive turnaround in the number of kids who no longer live in poverty. It's a statistic still, in as much as we've, to some degree, we've in that case, perhaps we could be accused of redefining poverty. So we've defined these kids out of poverty. I'm not sure, Judith, at any level that even with that kind of money that, living in a major urban center, and I suspect that's where most of your kids are, it's any easier there. But I don't want to finish on the negative. We're going to take John's comment as a positive because there is a best practice there that we can turn to and say, this works, let's do it. Is there something that is staring us straight in the face as far as you're concerned that says, here's how we deal with making sure our kids are properly fed?
If I may, on my side, the thing that is really obvious and emerging from our conversation is the need to break down silos. Really, and that's one of the great takeaway, let's say, of the pandemic. The ecosystem of food security did work more collaboratively, and I think these sectorial collaborations and health with education and social services and even intergovernmental work and making sure that all stakeholders across all areas and levels are involved in key strategic solutions for us all to develop comprehensive solutions that will make us all proud, right? If we have the opportunity to develop that national school food policy and implement a program, let's do it right. And in a way where that everyone's perspectives will be taken into account.
Yeah, I think that's sort of where we have found ourselves at a place, Dr. Kulik, where we're not really going to be able to ever say, well, that's the way we always do it. That's just not going to fly anymore. And so, I'll leave it to you to come up with your own perspective. But as we're talking here, I realize, we're focused a lot on making sure that these kids are well fed. Maybe we're missing the point, and maybe moms aren't well fed when they're pregnant. Maybe this conversation kind of to Judith's point, it isn't sort of stop and start. There's so much here that we have to look at in a very broad peripheral view that it'd be great to have a national program for the kids, and that might actually mean healthier moms and healthier pregnant women as you kind of move on to this. So yes, we should be focusing on the kids because there is need, but as we talk, I'm thinking, okay, if I'm not healthy, my kids aren't healthy. Then that cycle is really an important one not to lose sight of. But anyway, I will leave it to you. Is there something that has occurred to you, something that staring you in the face right now and said, you know what, 2.5 years ago, I never either would have recognized this problem or we wouldn't have had a solution that is this obvious to it?
I think just about your point before, I agree that a lot of parents, particularly moms, young moms, or moms with young children, if there's food insecurity, they're very likely to pass that food off to their children. And then what happens to them if they fall pregnant? They're malnourished. What does that do to the fetus? And what are the potential outcomes for that baby forever on? We know that there's an increased risk of prematurity and low birth weight, diabetes from poor nutritional intake. And we know very well that these problems can lead to further negative health outcomes forever. What does that then cost the system in all sorts of ways, educationally, mental health-wise, medical health-wise? All these things become very expensive. So while it's not that expensive, probably in a global sense, to feed this pregnant person, for example, if we don't allow that person to eat well, all the ramifications for years, decades, generations to come, it has profound impacts. But we often do think in these silos, as Judith mentioned. We're thinking in terms of health for this mom, health for this baby. But there's so many layers of impact in terms of their social lives, their emotional lives, their own nutrition, their own next children's nutrition, right? These things have generational impacts in so many ways. So I agree for sure to break down silos. before the pandemic, I didn't often honestly think about the types of which families might be getting these food programs at schools. And I love that the food programs at school you don't have to prove that you have, this kind of earnings at home. You don't have to prove you've not eaten at home, because otherwise, these kids wouldn't necessarily want to be in these, in line waiting for these foods because of that significant stigma. So I always was so happy that it was anyone. You could have had a beautiful, amazing breakfast this morning, but you're still welcome in this line, to reduce that stigma and the fear factor for all these other children. But where else can we be offering these programs, right? Maybe we should be offering more food in doctors' offices, for example. Maybe we should be offering food programs in community centers. We want kids to leave school, go home and eat a nutritious meal. How many families don't have access to that? Perhaps they can go to a community center and play basketball after school and also be offered something nutritious there. There are other touch points for children for things that are free services, like going to school, like going to the community center, going to the doctor's offices. There's all these different touch points for children that we can access. We often thought of these for vaccine clinics, for example. Where do people go? They go to the mall, they go to school, they go to the community center, they go to the playground. Where can we enable children to get a variety of services, such as nutrition, where they are? How can we meet kids where they are?
Yeah, well, now as you're talking, maybe we should just get onto the OBGYNs and have them prescribe a 3-course meal for moms expecting. I mean, there we go. We can kind of roll all of that in, and I can see that there'd be great enthusiasm around that. Listen, great discussion. John Stapleton, Judith Barry, Dr. Dina Kulik, thanks for doing this. I appreciate it.
Quite welcome.
Thanks for having us.
Our pleasure. Thank you.
Thanks for listening to the 2030 Project. We would encourage you to subscribe to this show. We're on Apple and Spotify, Google, Audible, pretty much anywhere you get your podcasts. We'd also be grateful if you'd offer a rating on the show. We'd love your thoughts, your feedback, even your criticism. The 2030 Project podcast series is sponsored by Daily Bread Food Bank, a Toronto-based charity whose mission is to collaborate with all to eliminate food insecurity and advocate for solutions to end poverty. I'm Dave Trafford, and the 2030 Project is a Story Studio Network podcast produced by Eye Contact Productions.